Hey, it's Dr. Jack Wolfson here, board certified cardiologist at Natural Heart Doctor. And we get a lot of questions about atrial fibrillation patients. Are they more at risk of COVID and other infections? And the answer is yes, because whatever leads to atrial fibrillation, whatever the causes are of atrial fibrillation, also increase the risk of COVID. So if you take into account obesity, higher risk of AFib, higher risk of COVID. High blood pressure, higher risk of AFib, higher risk of COVID. Lack of sleep, lack of sunshine, bad nutrition, diabetes. All of these things, again, lead to an increased risk of AFib and an increased risk of COVID. Now, also, we know that people who take pharmaceuticals for atrial fibrillation, those pharmaceuticals also increase the risk of COVID and other viruses. So ultimately, what I'm all about is getting people off of the pharmaceuticals, getting people to lower their risk of AFib and therefore lower the risk of COVID. So if we can improve our weight, we lower the risk of both. If we can get rid of diabetes or lower our blood sugar, improve the risk of both. If we can normalize our blood pressure, lower the risk of both. If we can improve sleep and sunshine and vitamin D and omega-3s and all of these things, we can improve all these different factors. So again, I'm Dr. Jack Wolfson, board certified cardiologist. Yes, you may have risk for atrial fibrillation, you may have AFib, you may have had ablations, you may be on pharmaceuticals, but there's always a better way to deal with your atrial fibrillation. That's what we're about at Natural Heart Doctor. Watch our videos, subscribe to our channel, email us. We are here to help you. I've been in practice for over 20 years. My passion is to get people healthy and well. I want to help you as soon as possible.